All right, let's go, everyone. Here we go. Thanks for coming. Let's go to the beginning. What we're going to talk about today, I'm Dr. Mary Rensel. Welcome, welcome, welcome. Thanks for coming. We're going to talk about how to feel less stuck, feel more joy, feel more choices, find more options, to find that career, purpose, meaning, joy, wherever that is. But, what is life like as a busy women doc? Today, we're going to talk about long-lasting solutions. We're here to learn. You guys are the rock stars, you women docs. I mean, but we're tired, we're toast. I'm still working as a woman doc. It's a busy life. It can be so, just so meaningful and so powerful at moments. And sometimes it's, there's just stacks of paper, et cetera. And, it's just exhausting, right? So let's go ahead and, talk about what it's like and who this webinar is for. It's for you busy women docs that want to help others, that want to feel creative, that want to acknowledge your accomplishments, that want to keep growing. You just love learning and growing and new things. I for sure do as well. So I'm on this journey with you. But I love some guidance on next steps and how to find the really safe, fun, exciting next step. I also was looking for a safe community to explore things where I knew it was a trusted environment. And that's what I've built within Brain Hammock. And I like support when I'm feeling scared or uncertain about my next steps. And so that's also what we put within Brain Hammock. And we want to feel like we have impact, right? That we make a difference in this world. I mean, gosh, as us humans, there's so many things that need to be done in this world and to serve others. How can we feel valued? How can we feel like what we do day to day will hopefully make a difference? I really, I hit a certain birthday and it just made me stop and think about that. So how do we make sense of the culture and the challenges in medicine? That's what we all want to, try to think about and focus on is, what are we going to, focus on? And we have this hour together. What can we get done in this hour? But let's make sense of the culture and the challenges within medicine. I like to call it brain wonder, so just get a little curious, wonder a little bit about our neuroscience structure, what it needs. How could it help us when we work in a high risk profession? And then I designed a framework because I was grabbing all this information and diving into the research and reading all these books that have really helped me over the years. And so I wanted to put it in a really clear framework for you to follow and use it uniquely with your own gifts and strengths and interests. So I like to call it priming, getting your brain ready to see those options, aligning with your own gifts and strengths and belonging, making sure that you feel like you belong where you are. And then designing, how do we keep it interesting day to day? And just to know there are solutions for us to help find that joy, that purpose, and meaning professionally. Well, one thing that really helped me understand medicine is to look at how business understands their organizational culture. And so this is a model, an organizational culture model. It's called Shine's model, and there's 3 levels of organizational culture. And there's the first level, like, just the classic iceberg. What do you see above the surface, the white in this image? And the white are the things that you can see very commonly day to day. Like in medicine, you might see where all the residents like to wear, fleece jackets, or you see maybe a stethoscope. In neurology, you'll see a reflex hammer. You'll see, hospital beds, nurses, aides, environmental workers. You'll see people that you say, I know I'm in a healthcare environment. It's very obvious there because there's artifacts that it's a certain culture. And you'll know certain norms, like, of course, it's patients first and safety and very low risk. We don't want to hurt anyone. If we're going to make a change, we want to really research it deeply so that we never would do anything to put anyone at risk. And then there's the lowest level. It's the hardest one to get at, right? It's assumptions and beliefs. And those are not written on the walls. If you hear those words, assumptions and beliefs. So certain things in medicine, we know that risks are dangerous a lot of times. So we tend to, move very slowly when we're thinking about a new project, a new protocol, a new medication. I mean, our medicines get tested for 10 years, a lot of times. So we have assumptions and beliefs, and these actually aren't written anywhere. So you have to sometimes work in an environment for a while to figure out these assumptions and beliefs. And the things that maybe aren't written on the wall or aren't written on the value statement might be something like, gender inequity that we see in the pay and the leadership opportunities in medicines. So there must be a belief that women shouldn't be paid as much or shouldn't be given the same opportunities. So there's assumptions and beliefs that usually aren't written down anywhere. I think of culture like this muddy pond. So look at this pond. There's beautiful flowers coming through. Those are the women doctors poking through, shining brightly, looking beautiful, really doing important things for the environment there. And the lily pads are there to support them and to get get the oxygen and nutrients. But culture is like that muddy pond. There's a lot of pieces and parts floating in it. History is in there. There's nutrients in there. There's things dying in there. There's things living in there. So culture is a lot of that, and it's a lot of that third level of the culture that we talked about. Is it's hidden. It's assumptions and beliefs. You can't see deeply into that culture, and I feel like medicine's a lot like that. And once you're in medicine for some years, things start to make sense, or you see certain patterns that are probably a lot of that hidden level or the dirty pond level. But what is it like for women in medicine today? So we could start in my area. I'm a neurologist. This is from a manuscript from some friends of mine, some really amazing neurologists. Oh, well, goodness. So they surveyed 798 neurologists. 35% were like, it's okay. They're a little dissatisfied. 42% were reporting symptoms of burnout. 56% were saying they don't even have time to do all their work, to do all the documentation that was needed. Many people were reporting high stress environments, lack of control over their schedules, high number of work hours, and gender discrimination in their cultures. But guess what? Women docs are doing great work. So when there's studies looking at outcomes of women doctors, amazingly, even some ICU studies showed, higher in mortality rates for male docs compared to women docs in the ICUs. And this study particularly looked at practice patterns and quality outcomes, and there were very positive practice patterns as far as sticking to guidelines and providing that preventative care that's needed and cancer-specific prevention services, staying on track with those and higher quality care from the women docs. So women docs are working hard, doing amazing things, helping the patients at really high levels. But yeah, what is it like for us day to day as working women docs? Can you remember that day you got your letter that you got into med school, that overwhelming joy? Like, oh my gosh, it's going to happen. I remember it. I was on a wait list actually at a few schools. I'm from Ohio, so I was on a wait list for a few state schools. And I remember calling my dad, and I was like, because my mom was home with me, so we were celebrating with her. And I called my dad, and like, guess what? Your daughter's going to be a doctor. And he just had some cute little quip answer because he didn't say much, but he had a good sense of humor. So I remember that day exactly because I wasn't sure what I was going to do because I was waitlisted, And so, yeah, that brings me way back. But now what about today? Like, what do you think about your work days? Are you like just trying to get through the days? Are you looking for opportunities for something brighter, something new, something that really uses your full strengths, your unique gifts? Do you feel stuck? Were you hoping like, gosh, I was hoping there was more? Are you sick of those annual reviews where the same things are said over and over, nothing changes? Do you wish someone would just bring to you a cool idea and be like, hey, have you thought of this? Here's something for you. I know all about you, and here's something I think would be great for you. Do you wish someone understood what you went through day to day, all those struggles? You wish that you felt more valued within your workplace. There's a lot of things I didn't learn in med school. Geez, there's a lot of things I did learn in med school. I just remember hours of studying. But there's a lot of things I never learned. And I don't remember ever learning about burnout. I don't think we talked about it then. I mean, I've been out of medical school for 30 years. And I didn't learn that there are tools that I should put into place because I do work in a high risk profession. I didn't know that. I didn't learn that neuroscience tools can be fun. They can actually be enjoyable, and that these strategies can bring some clarity to my weekly plans, right? And I can direct my professional growth. I don't have to wait for others to invite me to things. And that a new sense of energy is possible towards professional development, professional joy, by just kind of brain priming, by turning up or down certain settings on the brain. So we're going to talk a little bit about that. So what do you think, guys? Put in the chat. What do you think is the year that burnout was first reported in medicine? What do you think? What do you think? Yeah, put it in the chat. 92, 85. Guess what, guys? 74. I know. I was 8. So it's a long time ago. So burnout's been talked about for a really long time. And even just recently, there's been a lot of initiatives towards trying to solve the issue, national initiatives, local initiatives, state initiatives. And even the AMC did, released a report in 2021 saying there's a rise in all these wellness initiatives, but yet the well-being champions, people that were like stamped, hey, you're the well-being champion. Very little were trained or given any funding or time to do the position. So I actually know, I know a handful of people that were the wellness champion that burned out and left medicine, actually. So there's a lot of irony there. So I think, there's a need for accessible, impactful training. And there's a lot of people working on this, and that's a whole nother lecture, which I'm glad to give, which I do give. But yeah, so what is the problem today? I mean, there's no brain class. There's no like, here's some neuroscience strategies set into place. You're working in a high risk professions. We don't talk honestly about emotions. We keep saying they're from the heart. They're not from the heart. We don't connect our emotions as the gatekeeper to our work, like productivity, our ideas, our creativity. And we actually don't learn a lot about how to connect our neuroscience tools or powers unless there's a problem, unless you go see a psychologist or a psychiatrist, which please do if you need to learn these things. But usually, if someone burns out, they're taken out of medicine and then they work with a psychologist or a coach or something. But I don't know why we don't do it, on the flip side and do it earlier. And I know a lot of people are talking about that, but I feel like, why isn't that universal? It doesn't make any sense to me. I like precision. I like to be effective. I like to do things kind of upstream from the problem. So some other things I never learned in medical school is that work really helps us feel important and useful. And work meaning is linked to our mortality rates. But work can have positive or negative brain consequences. And we actually need to give our brain like extra support if we want to learn something new. So just by coming today, I hope that you are giving yourself extra support. What does that mean? That means, good rest, good movement, good nutrition, good connections. And we'll talk a little bit about why that's so important. We talk about that in Brain Hammock. That's my monthly membership for women docs. I hope you check it out. Look at, brainfresh.org if you want to see it. And we're going to get a real deal, toward the end of this so that you can jump into Brain Hammock. And we talk about brain priming, which like, how do you get your brain in that good setting so that you can learn and see options and feel joy? And how do you get ready to align with your own gifts and unique strengths? And then brain designing, like how do you use neuroscience tools to really build a really interesting career and keep it exciting over time? We're so used to getting a degree and then graduating and we're done in a degree. So we think we have to keep getting new certificates or new degrees over time just to keep things interesting. But I've really dove into the literature on this, and there's ways to keep life interesting without keep going to school, although I do love school. Okay, so once we learn about the Brain Hammock and our Brain Fresh approach, this framework, then you'll feel less stuck, less confused, less disorganized, less frustrated. We'll also talk about the power of anger, what anger can do and why we feel angry, because there was a burnout book that helped me so much to understand the power of anger and what to do, like how to angle it a little bit into an important direction, into a useful direction for me. And the book suggested all the things. We'll talk about it in a minute. So what are the results today? So if we, figure out this framework and you make it yours and I show you how to use it, women docs tend to feel empowered, informed, enthusiastic, brave, courageous. I've been doing this for a few years now. I've had a time management program and a productivity program, and I've coached docs and I've given lectures nationally to women docs. And I'm just so honored because people are doing amazing work and just really holding up their communities, so altruistic and so service oriented. But still, in order to do that, it's the whole oxygen mask, put your oxygen mask on first. So who am I? So why am I here? Why do I care about this? So I'm Dr. Mary Rensel. I'm a neuroimmunologist. I'm still working. I've been working in that field for up to close to 30 years. I have 4 kids and they're sprinkled in these pictures. I really like collaborating with other people. I've started 2 businesses because I wanted to keep life interesting. And I saw a need. I wasn't okay with the status quo actually in medicine and the opportunities for women docs. So I just thought I'm going to go hang out with builders and build something because I don't see the opportunity for me readily available. Yeah, I'm still working. I do work in my state for boards, in my community, I'm on boards. I, work on some national committees. So I do give of my time to make a difference for medicine, but I also wanted to start these businesses so I could really navigate it. I feel like it's like a party bus, like get in the bus, come on, we can drive it ourselves. We don't have to navigate these big institutions. We can take what I've learned and just use this framework to really keep life interesting and exciting. Who's ready? You ready? You ready? Can you tell I love lily pads? Do you know lily pad leaves kind of look like brains? Did you notice that? I'll show you some more. Okay, so now is a good time to get your handout out. If you don't have a handout, just get a piece of paper and draw these 3 big circles and a little circle in the center. And then each circle is going to have 3 lines. And I'm going to stop sharing for a minute and just open the whiteboard. Here we go. And we'll do this together. Okay, so you got your notes ready. Are you ready? Get your notebook paper, go run and get it, or get a glass of water. Okay, so far, why don't you put in the chat what's been meaningful to you while we get this ready? What's some news or some stats that have meant something to you? Culture. Yeah, it's hard to figure out the culture. I agree. So there's some comments about the culture. Comments. I have to look at my phone for the comments. Yeah, comments about a framework. It'd be nice to have some tools to follow, wouldn't it? Yes, I know. I've been waiting for this. Okay, so I am going to share this. No, we're going to go off this table. Okay, so what you're going to do is just start with on your paper. The first circle could be like the black square, or you could just draw something like what we're seeing on the whiteboard here. You could do this one too. So what we're going to say is this one is brain priming. And that's so we get our brain in a setting so we can see outlooks, we can feel creative, we can get new ideas, because if we're exhausted, we don't feel valued, we're starving, we've gone to the bathroom in 100 hours, all those things that can happen in medicine. It's just not the time to think that you're going to come up with some big ideas, right? So we call that brain priming, and brain priming we do throughout a busy workday. We do each workday. Yeah. So the first thing is this one, so I can see my whiteboard a little bigger. Okay. And then so brain priming, brain align, and brain design. Okay. Within the brain priming, there's 3 things. So we start with find your fun. Number 1. So that's the first line in brain priming. So write this down how you want. Find your fun. And then protect your melon. These are what it takes for the framework. Can't see it very well. There we go. Okay. And then fine tune energy.